So, hi everyone. Welcome to the webinar on food safety at home during COVID-19. Apart from food safety, we'll touch upon other couple of topics as well. But I think this has been a question that we've been asked several times on what are the precautions we need to take at home. So we will cover food safety and some of our best learnings. Right. So before we get started, a couple of housekeeping tips. The presentation is going to be recorded. We will also at the end of the presentation be sending you an email with the slides. But if you feel the need to take a snapshot or take a screenshot or a picture of anything you find interesting, please do go ahead. Second part is we love live Q&A rather than waiting for the Q&A at the end. So there is a Q&A box. So if you can on the Q&A box put your question, that'll be fantastic. Either me or one of the moderators will answer the question for you in chat. I'll try my level best to answer it live. But in case for some reason I skip it or miss it, my moderator will answer the question. So please do go ahead and ask your questions in the Q&A box provided. All right. With that, let's get started. So a little bit about me. My name is Ashwin Bhadri. I'm the founder and CEO of a company called Equinox Labs. Right. I'm one of the pioneers in food safety monitoring and FSSAI compliance. I also work as a national resource for the FSSAI. I've been one of the national advisors, for the last 4 years. I'm also an international speaker on food safety, and I work very closely with FSSAI on initiatives such as Safe Place to Work, safe and nutritious food at the workplace, FOSTAC, which is the training initiative, the hygiene rating for restaurants, Eat Right India, and many others. Right. I'm also an author of 2 books. The first one is 13 Ways to Protect Yourself from the Consumer, and the next is How Do You Face an FSFD Audit. Right. I also am a personal advisor to over 500 companies for their overall compliance and EHS policies. A little bit about Equinox for people who don't know about Equinox. We're a 15-year-old organization which works in the area of water, food, and air testing. We're one of the larger players in the country, and with a very deep focus on food safety and auditing. Right, we have more than about 14,000 customers across the F&B and corporate sector, and more than about 40,000 restaurants that we work with. We are the audit partners for companies like Zomato, Swiggy, Dine Out, and many more. Right, our audit reports are accepted across 160 countries because we are an FSSAI notified lab, an Enable accredited lab, and an ISO 9000 certified lab. Right, we've trained over 50,000 people in the area of FSSAI, FOSTAC, environment, and recently, obviously, COVID-19. We have more than 250 in-house experts in the area of food, water, air, food safety, all in-house. What this means is any time our customers face any problem, we're actually talking to one of the leading experts in the country to get the problem solved. Right. And what is not mentioned is we also have more than 700 auditors across 150 cities across the country. Right. As a workspace, as a workplace, we've won a few awards. We won the Operational Excellence Award. We've won the most impactful healthcare leadership award globally twice. We've won the Food Safety Leadership Award, and we've also been declared as a great place to work. Right. So with that out of the way, a quick snapshot about the services we offer. I'm not going to go into details of any of this, but we take care of food quality monitoring, food safety overall monitoring, FSSAI compliance, and environmental monitoring. We do in this water testing, which is absolutely critical, food microbial safety, which is critical, and all the other parts of FOSTAC compliance and FSSAI compliance, which includes training and auditing. And last but not the least, we do environmental monitoring. So let's get into the content that we've all come here for. So the first is planning it out, like, how do you plan nutrition? How do you plan safety at home? How do you prioritize fresh products? How do you prepare home cooked meals? What are the precautions to take? How do you manage food delivery? How do you follow safe food handling practices at home? Many of us are trained, at our workspace, but doing it at home sometimes doesn't translate the same way. We'll talk about sanitization, which is absolutely a key step. And I'm also going to touch upon a couple of innovations in the field that can literally change the way you manage safety at home. Right. So a quick introduction about the topic. We all know what is happening, right? So I'm not going to get into what is COVID-19, but we also understand that we are now taking stronger measures than before, right, to curb the spread of COVID-19. This will include self-quarantine, temporary closing of businesses, and which may affect our food-related practices. We will now be making food at home more often, ordering out maybe slightly lesser, but we should do order out whenever the stress of the making food gets too much. In all of this, and I think something that's going to sustain us all is going to be good nutrition. Is that going to be absolutely crucial for health? And it's times like this where an immunity practices and hygiene practices at home during the pandemic. And you can obviously continue those practices post-pandemic as well. It will definitely help, right? So the next part is plan it, right? So what is the concept of plan it? Now, I don't know about you guys, but me and my family weren't very, used to cooking from scratch. At home, we've always had somebody who cooked for us. But when me and my wife were kind of forced to cook, our portion sizes were completely out of whack since we had never cooked before. And we landed up making too much food, and we used to land up eating a lot of the food, and it did in the initial months, landed up with us putting on a fair bit of weight. And that, coupled with the lockdowns where you couldn't go out, you couldn't exercise, and in working is now work from home, sitting on a desk, right? So you get out of your bed, you come to a desk, and you're at work. So while there is an advantage, there is a disadvantage that your physical motion is now maybe 1/10 or 20th of what it used to be. Just getting to work or within work used to be there's so much travel, but now all that is cut down. So our activities have been limited. Our eating habits are not. So that did lead to a different kind of problem in many households. By the way, I did turn it around, and I'll maybe share the success story if I get the time. And last but not the least is, and especially kids at home, right? The kind of nutrition that we should be eating has slightly now changed. Our nutrition requirements are slightly lower, right? Since our physical exertion is slightly lesser outside the house. So we should learn what is that requirement, right? Maybe looking at the national food-based dietary guidelines that have been set, or maybe even talking to a nutritionist, and that's what I did, right? And which helps in understanding what are the healthy portions for adults and young ones, and being mindful of that while we go about our day, right? So while all this happened, it also gave us a lot of time to experiment, right? And we'll talk about that in just a second. So coming down to prioritizing fresh produce. So now all your food is now getting delivered, or you're going to the market and getting food home. Fresh ingredients with shorter shelf life needs to be used first, right? So understand the difference between things that can last long and things that get over quickly and who expire quickly. Now that could be things like bread and all, where there's an expiry date where it's easy to understand, but it also comes down to veggies and fruits and other things that you procure, right? And where there's a much shorter shelf life. So you want to use those things first, or maybe order them when they're required and not order in bulk. So I remember when the pandemic just began and the lockdown just began, people are hoarding food left, right, and center. And I think one thing that India did extremely well is their food supply chain wasn't hampered for a single day. And I think for that, there's a big standing ovation that we need to give to the essential service workers. I'm not only talking about the doctors and nurses, but all the delivery boys, all the traders, all the retailers, or the food manufacturers that kept that entire chain still running. There was not a single day, at least for me or anyone I know, where there was no food available. There could be, yes, instead of 6 choices, you probably had 4, but 4 choices were available and you could get access to them, right? I think that was fantastically handled. But while that is happening, I also seen a lot of food going waste, right? Because people started hoarding it, people started keeping it. A lot of food was going waste. So you have to be a little mindful of that, right? So fresh products, especially fruits, vegetables, dairy products, continue to be available, and you should be prioritizing them over non-perishables, right? Frozen fruits, veggies, which can be convenient to use over a long period of time, can be used later on, right? So there are some things that you can actually freeze and keep and will be okay to use over some period of time, things like corn and peas, stuff like that, which can go in the freezer, and you can use them, just thaw them and use them whenever you need. There's some things you can't do that, but some things you can. So knowing the difference is, makes a big difference, right? So avoiding food wastage is absolutely critical. You may consider freezing your leftover meals and having them as another meal. Right, so planning that out, even what kind of meals can be left, can be frozen and reheated, and some that can't, right? So understanding the differentiation between that is absolutely critical, right? So preparing home cooked meals. So it is now, when it started out, the pandemic, and we was forced to keep everyone out of home, no maids, no cooks, no nothing, right? And I'm very sure that happened to a lot of you as well. So in that regular life, many individuals often who didn't have time to prepare meals were now making meals, right? So while it was interesting for the first few days, we tried out all different things that we didn't have time to before, or didn't find the need to, since meals were already cooked. We had the time to do all of that, which was fantastic, right? We found a lot of healthy recipes. We found a lot of indulgent recipes in the beginning, which we wanted to try, and which worked out really well. However, that did lead to weight gain. That does lead to a lot of other issues that can come with it. Because before, I think most people, they will have home cooked food for a few days, but maybe going out was once an option. You'd go out maybe once in a week, twice in a week. But otherwise you would normally have, regular food, as people call it, which is not fat rich or salt rich or anything. But when you try out new things, you kind of start going out of, a little out of things can go a little out of hand, and you start making cakes and this and that and the other, so which can get a little dangerous for your nutrition, right? While all this is great, we also need to ensure that we are having a check on this. We are aware of how many calories we should be consuming. We are aware of the safety requirements that we should be following. So I'm not going to touch on safety right here. There's a full section on safety at the end. So you'll wonder, like, why is he talking nutrition and not safety? The reason is that we have all that good stuff at the end, right? So taking advantage of a wealth of freely available information, right, where we can experiment with new ingredients and keeping in mind what the basic principles of healthy eating is absolutely crucial, right? So food delivery. So we get asked this question quite a bit, like, is it safe? Is it not safe? As people who have been, in the food safety industry, I've been in the industry for 15 years. I'm considered an expert, right? And we advise a lot of the larger players as well. So while home cooked meals are always a priority, it is okay to have external meals once in a while. And sometimes maybe even, I know a lot of people who just don't know how to cook or staying alone. So they're ordering in a lot more, right? And it is okay to have that. A lot of the online ordering solutions do have something called as a contactless option, right? Where you can keep a stool outside, the person keeps it there, steps back, you pay them online. So it's literally no contact between you and the person. So that way it is safe. The next part comes like, how do you take that food in, right? Before that, just a quick note: when you're ordering food online, look for restaurants which are hygiene rated, right, with an excellent, very good hygiene, because you know that they are following processes behind the scenes, right? Two, irrespective of where you ordered from, even if you ordered from a hygiene rated restaurant, once the food reaches your home, try and collect it in a contactless manner, pay contactlessly if you can. But once the food reaches your home, when you take it in, sanitize the containers before you take it inside your kitchen, right? Alcohol, the spirit bottle, which you should be having at least 2, 3 of around your home, the big one, the small one, depending on how much you use. My house uses a 500 ml bottle every 5 to 7 days. So yeah, we are a bit of hygiene freaks, if you want to call me that, right? We are from the industry, so we unfortunately understand the good and the bad and the ugly of the industry. So we are a little bit overcautious, but anything that enters the home has to undergo a sanitization process. So in case when food comes in, just spray a little bit of alcohol on top and just wipe it down before you take it inside. Once you take it inside, transfer. So the bags can be thrown out right near the door. Take the food containers inside, place them on a certain part of your kitchen, transfer all the food into either microwavable containers or containers that you can heat the food in, and definitely microwave or heat the food uh, before you eat it, right? So at least for a minute to minute and a half in the microwave at full capacity for a normal dish is more than enough, where the dish at least comes to a boil. Or if you're boiling, or if you're heating it on a stove or a hot plate, make sure the dish comes to a boil, at which point in time the virus has been neutralized and other any bad things have been neutralized, right? And it's safer to consume, right? I hope that makes sense. So following some of the food handling practices, right, at home, one is using safe water. But this is not being harped enough, right? Because yes, the virus doesn't get transmitted by you drinking water, right? Neither, by the way, does it get transmitted by you eating food. But however, the surfaces around the food can be a carrier, right? So if I touch food, so let me give you a not so nice example, right? And I'm going to keep it very simple. Let's say I ordered a sandwich, right? Somebody before packing the sandwich sneezed on it. They shouldn't be doing it, but let's say that happened. So me eating the sandwich, even if that has a virus or anything on it, nothing's going to happen to me. But if I touch that sandwich and then I touch my nose, now I have transmitted a virus from the surface of anything. This could be a sandwich, a surface, a door handle, anything, to my nose, right? Which is why basic hand washing, basic hygiene becomes absolutely paramount, right? So again, so same way with water, make sure that using safe water, your water is potable. The raw materials that you're using are sanitized and are safe, right? Avoid cross contamination between raw and cooked food, and especially between raw meat and fresh produce. Just to make things worse, we also had an attack, on the poultry system. We all know what we're talking about, right? So ensure that any poultry that you're having, any eggs that you're having, any meat that you're having is washed, is heated up, and then consumed over 70 degrees. So if you're having omelets, if you're having chicken, please make sure that you are sanitizing the eggs before using, and you're heating the chicken before consuming it. If you're touching raw chicken in any form, please make sure you wash your hands before you touch anything else. And as long as you cook the chicken and cook your eggs, you're fine. The bird flu is not going to affect you. However, if you're handling either raw meat or birds, you may want to be a little bit more careful. You want to mask up, you want to sanitize your hands, and so on and so forth. Right? The numbers are decreasing now, but nonetheless, things weren't bad enough where we got attacked by bird flu as well. Right? So personal hygiene and personnel hygiene becomes absolutely critical. Keeping your hands, your kitchen and utensils clean and sanitized becomes absolutely critical. Anytime any surface is kept unsanitized for a while, before you start cooking, just spray a little bit of sanitizer on your work surfaces and then start. If you are opening, closing doors often, which you will be, make sure your door handles are sanitized. Make sure the cutting board, everything that you use is cleaned just before use and obviously after use. Right. So that's an extra step you'll need to follow. The before use part. I know a lot of people will obviously clean after use, but many people will just take something while lying around and just start cooking with it. You may want to add one more step of sanitizing it, washing it, cleaning it, sanitizing it, drying it, and then taking it for use. Uh, Cooking your food thoroughly. Now, what do I mean by that? Your food needs to be cooked at 65 degrees and above, right? Typically 70 degrees and above, to ensure that it is safe. Okay. Two, very, very, very important. Cold food is kept cold, hot food is kept hot. So if you're going to be holding food for a long period of time, make sure it's held above 60 degrees, or if it's cold food, it's kept below 5 degrees. So if you cook food, it is okay for it to be out for up to 2 hours. So this is for home. Many of these sentences are probably designed for larger facilities where the food is cooked in the morning and served in the afternoon and things that way, where there are bin marys and things. Unfortunate homes, we don't have bin marys. So any food that is cooked can be kept outside safely for up to 2 hours, after which it needs to be transferred into the fridge. It can obviously be then taken out and reheated one more time, and then anything left or after that has to be discarded. So when you're reheating, so let's say I make a kg of biryani, right? We consume half a kg in the morning and there's half a kg left at night. But we don't want to consume, only I'm eating biryani, my family, let's say, is not. So I just take a portion of that biryani and heat that up. You shouldn't heat up the remaining half of the biryani, take a portion and put the remaining reheated biryani back in, right? It may sound like very simple advice, but I've seen this being violated like 100 times. Like people, they know this, they don't land up following it, right? So it's very, very important that these very small steps be followed during this time. Next is, sanitization at home. What do you do and when do you do what do you do when you leave your home and what do you do when you come back inside? Do not forget to wear a mask when going out. Just don't do it. Is the equivalent of not wearing pants. Do you wear pants when you leave your house? Yes, you need to wear a mask when you leave your house. It's literally that way. The other day, something was happening. There's some chaos at the door, and I stepped out literally 3 steps outside my own house. And I realized I'm wearing a mask. I ran back in. And it was in spite of like 20 distractions. When I stepped out, I realized I'm missing something. Imagine stepping out, out of your house with your pants off. You'll probably run back in exact same way, right? Make sure you do not step out of the house without a mask, right? I don't think we've touched upon the kinds of masks in the presentation, but let me take a minute here and enlighten you to whatever I know about masks. The surgical mask, right? The cheapest 5 rupee mask is literally the 3-ply surgical mask is the best thing to use. Do not use cotton masks. They do not work. So in the order of availability and comfort and whatever, the first one to use is a surgical 3-ply mask. After that, actually, is the N95, right? So I was talking to one of the leading specialists of lungs and people of fighting at the forefront of COVID-19. Right? And they said that N95 masks are better than a cloth mask, but they're not as good as a 3-ply surgical mask for many reasons. One is an N95, yes, it keeps all the particles out, but it's not allowing your breath to go out. So you are rebreathing a lot of carbon dioxide, which is not natural. Over time, it will cause you harm, right? And just to let you know, you wearing masks is not going to stop anytime this year or next year or the year after that. Wearing masks outside is going to literally be the norm for the next few years, because after some time, it's just going to become basic hygiene, like Japan. Like 90% of people in Japan wear a mask when they're outside the home, way before the pandemic, right? Because it's just a sanitary thing to do. At which point in time, the virus is not flying around everywhere. Yes, you may switch to a different kind of mask. but wearing a mask is going to become second nature, right? Two, carrying a mask in your bag is always critical. The reason is you're wearing a mask and you have a spare one in your bag, because if this mask breaks, you're in deep, deep, deep trouble, right? Third is when you're handing a mask, do not touch the outside of the mask. Always use the loops to put a mask on and to take it off. Never touch the front of the mask, because that is where the maximum load, viral load or bacterial load is, right? So if you touch that, it's okay. By mistake, you touch it, no problem. Go wash your hands and you should be fine. Carry around an alcohol-based sanitizer with you at any given point in time. Anything you touch outside, you don't know whether it's been sanitized or not. You need to sanitize your hands, because by chance you're going to touch your face, nose, eyes. I know you have a mask on. A lot of people scratch their beard or try and do something, and you don't want unsanitary hands to touch your face and get access, get the virus inside, right? So you want to take those precautions. The next one, we all know the 6 feet distance in public places. We also know that that is not possible, right? But wherever possible, try and do that. Something as simple as when you get into, you call the elevator and you already see 4 people inside, skip it. Just take the next one, right? I know the symbol will say 5 inside or whatever it is. If you feel it's crowded, not worth the risk, don't go inside, right? Uh, Next is avoid contact with unclean surfaces such as tabletop, store shelves, ATM pin pads. But now there are times when you can't avoid this, right? You're outside, you need to withdraw money. Where are you going to go? You need to go to an ATM. You can carry a toothpick, you can carry a glove where you can wear and touch it, and then you throw the glove out or you sanitize the glove later on. So there are multiple things that you can do to avoid direct contact, with unclean surfaces. Footwear that is worn outside the house needs to either sprayed with a disinfectant or you leave it outside the house when possible, right? That's something I've never done my entire life, like take out footwear outside. But now there are like 8 pairs of slippers and shoes outside the house. I know it looks horrible. You know what? It's a pandemic. I don't care, right? And two, whenever you come inside, you need to sanitize your feet. You need to sanitize your hands, right? So I'll run you through what me entering my home looks like, right? I need to take out my slippers or sandals or shoes outside the house. I'm going to step in. There is an alcohol bottle. I'm going to spray alcohol on the ground. I'm going to make sure my feet are clean. I'm going to spray alcohol on my hand. I'm going to make sure I wipe my hands for about 20 seconds with the alcohol. And then without further ado, not doing anything, wear slippers, which I've been inside, and go straight for a shower, air shower, full shower, a 10-minute shower, not one of those 30 seconds in and out kind of shower, a 10-minute shower where you sanitize your full body, and then you come out with a fresh set of clothes. The clothes you wore, go straight for a wash. Do not reuse clothes, right? Now, some people may find a lot of what I'm saying a little extreme, and I do understand it's a little extreme, but guess what? We are in an extreme situation. This is not what I did before the pandemic. That would be crazy. But right now, since we're in the middle of the pandemic, these are the precautions that we are taking upon, right? Then after you do all of this, please make sure, or when you enter the bathroom, please, again, I know you sanitize like 30 seconds before, wash your hands again with warm water and soap for at least 20 seconds. The way you do this, or 20, technically 30 seconds, the way you do this is by singing happy birthday in your mind twice. This trick I use with the kids. Sometimes if I can't keep track, hell, I sing happy birthday, right? Because that's the only way you know that you spend the right amount of time. Okay? And last but not the least, masks, gloves, and other plastic bags can be disposed of, right? At the doorstep in a separate container, which can go directly outside. Right. So at the door, we have a separate container which is designed for the masks to be thrown out. Any gloves that we wore outside are thrown out. Anything that we bring in. So, for example, when you bring in a parcel, actually, you know what? I think we have a thing on parcel. I'll cover it there. Right. This is one of the most asked questions. Like, how do you sanitize veggies? Right. At home, how do you sanitize veggies? In office and in big canteens, you have your Suma tabs, you have a three bucket system, and all this. At home, what do you do? Right. First and foremost, before and after handling raw vegetables and fruits, please, please, please wash your hands. Two, very, very important, especially during mango season and other season. Many people have a habit of smelling their fruit before they buy. It's okay, you will get a bad batch, it's fine. Do not smell the fruit. I've seen so many people doing this, smelling the fruit and putting the mask back on. You might as well just not wear the mask, right? The fruit has been touched by 200 people before it got there, right? And 200 other people before you have touched the fruit, right on the same day. Not worth the risk. Do not smell the fruit before you buy it, right? I know it's a habit a lot of people have, but By the way, I'm not one of them because I don't know how to determine whether the smell, whether the fruit is good or not. I'm not a very fruit person, but I've seen a lot of people do it. Please don't do it, right? You can, once the food comes inside, what typically you can have is two kinds of baskets, preferably color coded. If not, then it's okay because at home you may not have color coded baskets. But have, if possible, color coded baskets. One where the outside food which has come in goes in that basket. There are two things that you can do after this. First is you can use sodium hypochlorite, right? Solution with water and make sure that you wash your veggies with that. What this does is it releases nascent oxygen, which will destroy viruses and bacteria, right? So you can even soak it for some time in this and then rinse it again and then put it back in the fridge or dry it and put it back in the fridge or wherever you keep it. You can even, I've seen people using mild detergent to wash veggies. Not the most recommended one. If you have nothing, then yes, it's better than nothing. But sodium hypochlorite is obviously better. But the best thing that you can do, and now which has become extremely affordable, back in the day it wasn't affordable, but now it's become affordable, is ozonation, right? For people who don't know what ozone is, oxygen is O2, ozone is O3. The way ozone is created is by taking three atoms of oxygen, passing it through an electric arc, forming two atoms of O3. The half-life is about 10 minutes, meaning it will, after 10 minutes, dissipate back into oxygen, right? Ozonators back in the day were used only in very, very high-end water treatment plants. I have some background in that, so I'm aware of that. We were one of the first companies to bring ozonators. We, as in not Equinox, the company that I worked in before, were the first ones to bring ozonation into India. But now it's available at a home level. You have multiple brands available. Go on Amazon, type ozonator. You have things starting at 2,500 all the way to 20,000. All of them do the same thing, so it doesn't matter which one you buy. Just the model and the sizes and the accessories they come with are different. The way ozonation works is very simple. You get a little bucket or a little basket. You fill water in it, put your veggies in it, put the ozonator in it, put a little the what is called the diffuser, run it between 10 to 20 minutes, and you're done. No chemicals, no worrying about how much sodium hypochlorite to put, none of that, right? So if you don't take away anything from this webinar, take away the ozonator idea. It's going to make sure, and by the way, this is something that we're not doing for the pandemic. We've been doing this for the last 8 years, right? And what happened 8 years ago? We had a kid 8 years ago. That's what happened 8 years ago, after which we became a little bit of hygiene freaks then. So this was nothing new for us. Ozonation is something we've been doing since then. So it just continued and definitely helps us now. But definitely now is a good time to bring ozonation if you haven't been doing ozonation. All right. The next one is, how do you sanitize parcels, right? And today with Amazon and a bunch of the delivery services, everything from pin to piano can get delivered from your phone. You just order, click, click, click. I've gotten orders in less than an hour to in less than 24 hours, right? So when these parcels come, first of all, you can ask for a contactless delivery where they don't hand it to you. Best way to do it is keep a simple little plastic stool outside. They can keep it on the stool and step back. Stop doing COD, pay online, just easier, lesser things are transacting, right? But once this comes in, please make sure that the surface of either the outside box or the inside plastic packaging is sprayed down either with a simple disinfectant, and then you can wash your hands after, and with alcohol and with soap, 20 seconds alcohol, right? So that's a simple, I'm not going to teach you about hand wash again. We have another slide going a little bit more in detail in hand wash. But very, very important, after you use a disinfectant, and you'll probably use your hands to wipe down the surface, do wash your hands, all right? Wear a face mask and gloves even when a contactless option is available. Wear a face mask and gloves when you're opening the door to take something from outside, right? Dispose the outer packing of the box. Like you'll see a lot of these boxes, they're outer packaging. If possible, right outside your house, if there's a provision. If not, inside your home, make a little box or whatever, which you can dispose this in, so that doesn't enter your home. So maybe the first 20 square feet near your door becomes like a mini quarantine zone, right? In our house, it's referred to as the contam. My kids will not enter that zone unless they're in a mask and a face shield. So if I don't want them to play with a toy, I just literally in front of their eyes will move it across a make-believe line, and I'm saying now it's in contam. They will not go there. They have been literally trained. And anytime anyone's coming from outside, they've also been trained not to hug their grandparents or their mom, dad when they come, and they will literally scream contam and they will run. Now, this small little thing has gone a very, very long way to communicate the importance of hygiene to kids, right? So we came up with this concept of contempt, but literally they will run away from me when I enter home, have gone down to get something. And if I by mistake come close to them, they'll be like, "Have you had a shower?" I'll be like, "No." They're like, "Contam," and they will run, right? Because they've been taught that, hey, if you come in contact with contam, uh, you will probably fall ill, right? And nobody wants to get COVID, even though they don't know that if you get COVID, you'll recover and all that jazz. But it's better that we don't test that out, right? We don't test the theory out. So please make sure that whenever these packages come in, they're sanitized, right? So clean the surface of the package. When you're opening, also again, clean the inside of the box and then wash your hands again. Again, if possible, where possible. And if it's not things like groceries and things, please make sure that that package is kept near your door for at least 24 hours before you bring it into the house, even though it's sanitized, right? So we do that. If you order books or anything that is non-perishable, there is a small little table, plastic table that's kept near the door. It's kept over there, and we bring it in after 24 hours, and then we wash it, sanitize it one more time. Now, why are we being so particular? Is because the virus can survive on surfaces for a long time, right? Hence the extra precaution, right? Now, as I promised you, we are going to show you how to sanitize your hands. So by the way, this method which we're talking about is by WHO. And one of the companies that we did some work with, GoShore, they have this really cool thing. I'll show you in a second. I don't think it's here, but maybe I'll tell you about it. Which ensures that you wash your hands and you sanitize your hands the right way, right? So the right way of doing it is first you need to do this, right? Which makes sure that you lather the soap. Then you need to go between your fingers, right? Many people just do this and they call this hand wash. No, this, all these areas, including this, doesn't get clean if you just do this, right? So extremely important. First, you lather the soap, you take it between your fingers, right? Like this, back and forth, up and down, back and forth. You need to do this because you need to get under your nails, behind your hands, and here. So when you do this, I don't know if you can see this, like this, you're getting behind your nails, you're also cleaning this part, and you're also cleaning this part, right? And the most forgotten part of any hand wash is this. Because while you're doing all this area is getting ignored, right? So doing this is absolutely crucial. And last but not the least is this, right? What is this step? This step is where you want to ensure that nothing is below your nails. No matter how often you cut your nails, could be once a week. Even in a week, your nails will grow a little bit, and the surface below that is something that contaminants can stain for a very, very long time, right? And the beauty of what GoShore does is it actually, if you have a product at home, I did, since we're in the field, I bought one. It ensures that by the way, this is maybe with soap or maybe just with sanitizer, right? It actually uses sensors to make sure that I'm following all these steps. And if I don't, it'll give me like a red thing saying ineffective sanitization, right? So anyone who leaves the home has been trained that when you come in, we do the alcohol for the feet, but for a hand, we just put our hand under the GoShore piece and we get sanitized, right? It sprays the sanitizer on my hands and we follow these steps. And if you don't follow the steps, it will give us an error, right? So very, very cool thing, not required. Honestly, it's a little more than what is needed to be done. But since we're in the space, I had access to it. We tested for them, their products, and we validated it. So I had access to the product, so I did buy one, right? So that was very interesting. Next, but I think this covers most of our points. I'm going to pause here for a second to see if anyone has any questions, because now the next part is I'm going to talk about a couple of innovations, and then we're going to kind of end. So I'm going to pause over here to see if you have any questions. All right, I'm not seeing any Q&A coming in. Awesome. All right, so I'm going to jump ahead. Feel free to add Q&A whenever you can, right? Or if you need to understand something more. I want to talk about one of the latest innovations in the field of sanitization, which many people haven't heard of yet, right? And this product, which I'm going to talk about, is actually something that I didn't believe when I heard it until we actually tested it in our own laboratory, right? That's the advantage of having your own lab, is you can test things out, right? So the concept and the product is called CPD, which offers a 12-hour continuous protection. Now, what does this mean? Uh, First is when you spray normal any sanitizer alcohol on a surface. So let's assume this is a wall, right? Or this is my door handle, right? This is at the moment dirty. when I spray anything, it can be Savlon, Dettol, alcohol, anything, right? And I clean it. Now the surface has become clean. It's become even sterile, right? Because when you disinfect, you actually go to the 99.99, right? By the way, sanitize takes you to 99.9 and cleaning takes you to 99%. Sanitization 99.9 and sterilization, right? Oh, sorry, and disinfection takes you to 99.99. Dettol, alcohol, all disinfectants, right? Very, very strong, very powerful, will take you to 99.99% cleanliness, right? However, 10 minutes later, somebody comes and touches my door handle and their hand is unclean. Now my door handle has again become unclean. And 10 minutes later, I come and I open the door. Whatever was here is now on my hand as well. This is called cross contamination, right? I hope this is something we've heard of the concept. Most of us know what this is. Now, the difference between a normal sterilant or a disinfectant and something like a CPD is that instead of putting any other alcohol or anything else, I spray CPD on this, right? Immediately, yes, it is disinfected 99.99%. However, 10 minutes later, somebody who didn't wash their hands or contaminated hand comes and touches this, right? And goes, and 10 minutes later, I come and I touch it, it is still clean. It is still maintaining that 99.99% cleanliness because it has nanoparticles that hold on to the surface and continue killing the germ. Now, when I heard this, I was thinking bullshit, right? One more gimmicky product that has come in, and the person who's brought this to the country, they told me about it. I said, yeah, I said, whatever. They said, okay, we're doing this. I said, it's bullshit. They actually sent it to our lab for testing. The product is out of Israel, right? And we tested it and it actually worked. The report says 12 hours. We tested for 16 hours, 18 hours, and it continued to kill for even 16, 18 hours up to 24 hours. The company claims 12 hours. We validated the claim as well. That's the reason I'm comfortable talking about the name, because we've tested the product ourselves, right? I use it in my home, we use it in our office, and the product works really well. The reason I'm telling you about this is at home, in our buildings, in our societies, in our offices, we have staff who's supposed to clean things. They may not always do it. Something like this, I'm aware when I or my maid or somebody sprays the door, our door inside and outside, two sprays each, we know for the next 12 hours, we don't have to keep wiping it down when somebody goes in and out, right? When the building sprays it on the door, the lift panels, we don't have to worry whether the guy every hour is going and wiping down the panels, right? And the same thing for our office. So an interesting product to look at. In case you want this, I'll show you a number at the end. Reach out to my team. We'll connect you. We don't sell this. We'll connect you to somebody who can get this for you, right? And it comes. You can buy one can. We can buy a carton, whatever it is, right? So this is something that has been one of the innovations in the field, which I think has really changed the game for sanitization in our country today. And this works on all kinds of surfaces like plastic, metals, fibers, fabric, curtains, etc. And there is no bad odor. It's non-corrosive and extremely easy to use. You just spray and you're done. There's no measuring something, none of that, right? Last but not the least, I want to leave you with a way where you can get the latest information on FSSAI, on food safety. Is an app called Food Shots, right? It's a free-to-use application. There is no registration also required. It's available on the App Store. It's available in the Play Store. And every day there are 6 simple, easy-to-read articles, literally like you can see on the left-hand side of the screen, where there is an image, there is a headline, and there is 60 words of text. If you like the article, you can just swipe left and read the whole article from the original source. We source articles from 60 of the top sources in the country. It's a free service from our end to ensure that we educate our customers, we educate our ecosystem with whatever the new things which are happening. So do take a minute out at the end of the webinar. If you have a second now, point your phone to the QR code. It'll automatically download the app, or go to the app stores and download Food Shots. Absolutely free, no registration, no mobile number, nothing required, right? And if you like an article, you can always share it in your group or wherever it is. There's a nice big bold share button if any article is suitable for your family or your this thing. Any of the WhatsApp groups, very, very easy to share. That kind of brings us to the end of the presentation. I'm very sure I've spoken about things that you are aware of, right? I'm hoping that I spoke about at least 1 or 2 things that you are not aware of. But what I'm really hoping for, that at least one of these things you take back and apply in your life, tell a few people about it so that we can make the place a little safer, we can make the place a little better, and we're able to fight the pandemic a little stronger, right? That brings me to the end of the presentation. If you have any questions, I will stop over here. Uh, there is my email ID, Ashwin at Equinox Labs. So if you have any questions down the line on anything we've discussed or anything else, feel free to email me. I'm happy to, I check my emails. They normally get responded within 4 to 8 hours. I have my teammate Komal, whose information is here, and her phone number is there. Anything about our services, products, anything, right? I spoke about CPD, I spoke about ozonators, anything you want information, anything else, just write to her or call her up, and she'll email you right away with whatever information you need. And last but not the least, if you want to stay in touch with me over a longer period of time, you can look up my name, Ashwin Bhadri, on LinkedIn, on Instagram. I'm very, very active on both the platforms, especially on LinkedIn, right? And yeah, I'll be happy to stay in touch with you guys. I've gotten one question. Okay, this is from Chitranjan. Hey, are we going to have a similar situation using cafeteria as was before? Uh, Chitranjan, that's a great question. So I think the answer to that is we will probably go back to using the cafeteria the way it was before. However, for now, there will be some restrictions. You'll probably see that buffets are no longer going to be the norm. It will probably be a la carte portions, or even if there's a buffet, it's not you serving yourself. There's probably somebody on the other side serving you and giving a plate back, just to maintain a little bit more hygiene, right? So that's going to be one change. But very, very, very soon, once things go back to normal, and things will get back there, but it's going to be a little bit of time till we get back to how things were right before, right? Right now, there's a lot of talks on offices, being shut for some time, working from home being the new norm. But while the reason we did this, right, is not because households are our customers, is because many of our customers are at home, right? So we wanted to do something where we can give you all some tips, tricks, some things that we have learned. We wanted to share that, some best practices, some new, innovative things that we have learned that you can take back home and apply. And hopefully that will keep you safe, your kids safe, the elderly safe, and keep your whole family and all in your building safe, right? That's the overall idea. Many of the things we spoke about can be applied to your workspace, but not really. We have another entire session for workspace. So if you'll ever want that, do keep an eye out. I'm very sure we'll do another session for workspaces, right? Anita has a question. If we order pre-packaged food for team lunches, how can we ensure safety of outside packaging? Packing. Fantastic question, Anita. So the way you want to do this is, one, you want to spray the outside with alcohol, and one, just rub it down so that to kill anything. That is point one. And point two, in an office environment, I know you don't have the luxury of then transferring it into a bowl and heating it up. So I think the only thing you can do, one, is order from places which are hygienic. Looking for a hygiene rating is a good way of doing it, or ensuring your vendor undergoes a regular hygiene audit, right? If you need any help with that, my team can help. So that is point one. And point two is, when this comes in, sanitizing the outside, just using simple alcohol will do, right? Just as alcohol spray, 2 sprays on a container, and just having it wiped down, next, wipe down, next, will help, right? And three, if the pre-packaged lunches are going to be there, my suggestion is to encourage microwaving them before they're consumed. This is just my 2 cents. I hope that helps. Thanks, Anita. Yeah, the PPT, Anita, will be shared with you, I think, before end of day. Are there any other questions? Okay. Chitrangana, it is always good to share info for households too, as they also get a good support and boost up their way of using things. Absolutely. Thanks, Chitrangana. That was the whole idea. So by the way, one of the things that we're also doing very soon, we are also doing a webinar on parenting through pandemic. From what my research team tells me, is I think that's going to be one of the most packed webinars in the history of our company. The last most packed webinar I had was 1,600 people on a single webinar. And this was around when the pandemic began, right? My team is forecasting that we'll probably have anywhere between 4,000 to 5,000 people, or maybe more, for parenting through pandemic. So anyone who's a parent will need and will knows that there is going to be a need of parenting your kids slightly differently through the pandemic, because it's put a lot of stress on them. It's put a lot of stress on us, right? I'm a parent of 2 kids. I know what the pandemic is doing to them. At the same time, I also know what the pandemic is doing to me and how I react to them. So I have to be very mindful of that. And I'm getting literally India's best experts to come in and guide us. I know I need it. I'm doing it literally for myself. You are just getting benefited. I'm just kidding. Right. So we're calling the best experts in the country to talk on that webinar as well. So look out for that. And I'm very sure if you got this information, you'll get that information as well. And that I think should be an interesting one. And if you think there's any other topics that you want information on, do write back to us. Go fill out any of our forms or write back to info@equinoxlab.com or webinar@equinoxlab.com with suggestions. And I would love to hear from you. What kind of things you would like to hear on, and we can do more and more webinars based on that. All right. So I think that brings me to the end of the session. If there's anything I can do for you, please let me know. Do stay in touch with us. I would love to stay connected on LinkedIn. Or if you have any questions in the future, do email me or Komal. And you have Komal's number as well if you need to talk to her instantly about anything. All right. So go ahead and have a fantastic week ahead, guys. And thank you for being such a great audience. And I'm looking forward to seeing you all again soon. Thank you. Take care.